What's your type? All February long, we're bringing you quizzes to unlock your personal power formula. Health, wealth, self-care, and happiness. Grab a pen and paper because our next quiz starts now. This week's quizzes are all about how to unlock your personal health power. Today, we're revealing the real culprit for something that affects more than 60 million of you at least once a month. It can feel like burning in your throat. Try to find yourself in this, right? Or it could be a pain in your chest. Sometimes that's worrisome. It could even be a sour or acidic taste in your mouth. Of course, I'm talking about heartburn. You're about to find out what your type of heartburn is, plus a personalized plan that can help you get rid of that pain super fast. Join me now, emergency room doctor Samson Davis. Samson, I trust you on this stuff. You're dealing with people coming into the ER all the time. One of the most urgent reasons is chest pain. So when a lot of people coming in like they are these days with COVID and they've got chest pain, how do you differentiate if it's heartburn or a heart attack?
Yeah, I mean, Dr. Oz, it's concerning because you want to make sure, obviously, you're not having a heart attack. So heartburn usually presents with symptoms similar to a heart attack. You get some like a chest pain, you get the burning sensation as well, usually with heartburn, like that sort of reflux feeling. And you get that sour sort of metallic taste, whereas a heart attack is usually just kind of crushing pain. It can travel to your jaw, your arm. You may have some nausea, some shortness of breath that is associated with it. And the pain usually tends to spread across your chest. And you can have dizziness and lightheadedness. But they're similar, but chest pain related to a heart attack is a bit more prominent and significant, obviously.
Most important clue to me, because I'm a heart surgeon, is shortness of breath. That worries me the most. And you don't usually get shortness of breath when you get heartburn. Any case, let's focus on that issue which affects so many Americans. I have twin sisters who say they both have heartburn. Jen and Jess join us now. So Jen, thanks again for being with us. Describe how often you and your sister complain about heartburn. I want to hear some whining out there.
Like literally like every other day. And it's so uncomfortable and it sneaks up on you sometimes. Like we know it's going to come, but when it comes, it's still a surprise and it's so uncomfortable and scary. Yeah, it's like it would just be so great to live our lives eating the foods that we enjoy and not have heartburn.
All right, so Jess, I want an honest answer here. Who do you think has the worst heartburn? Or better yet, who's the most vocal about their heartburn?
It's definitely me. Oh my goodness. I know it's going to happen, but it still catches me off guard. So literally, I feel this burning lava sensation. It just goes up through my chest, through my throat, and I'm literally in tears. So I call Jen all the time. She's my lifeline. Yeah, I try to calm her down, but it's just.
All right, so I'm going to help you both out. We got a quiz to help you and the rest of America figure out your heartburn type. Put all the family feuds out there to rest because there are lots of families that will have multiple members with the problem. So keep track of your answers. We're going to tally them up at the end. We got A's, B's, and C's. You good with this?
Yes.
All right, we're going to put the quiz on DrOz.com just in case you missed the show. So the first question. At night, I am most likely to have A, big glass or maybe two of red wine, or maybe I'm snacking. B, staying up to binge watch something on Netflix. Or C, worrying about tomorrow's to-do list. So Jen and Jess, hold up your answers. What are you most likely to do at night? Oh.
C. I always have a to-do list with me at all times. Yes, and I love to unwind with my red wine plus the side of chocolate.
You guys look the same, but you have very different answers. Dr. Davis,
Yes.
next question.
Red wine and side of chocolate. No, next question is, I would describe my dinner as A, full of flavor, the spicier the better. Late, B, I eat after 8 p.m. Or C, quick and sometimes very little. I'm rushing to answer emails and do all my tasks.
Jen and Jess, the rest of America, hold up your answers. Let's see what you got there.
I'm going to go with A, B.
Jen, you took B.
Yeah, I plan everything, even my meals. They're late at night. Well, I love spicy food. If it's bland, it might just sit on the plate. Give me the spice.
Okay, come on. Next question, all right? When do you feel that uncomfortable burn? Is it A, usually an hour after your meals, B, wakes you up at night, or C, where I'm at my busiest, the worst time it could possibly happen? All right, keep track of your answers. Dr. Davis, next question.
So our next question here is, where do you keep your antacids? A, on my kitchen counter so I can take them before I eat. B, on my nightstand right by the bed. Or C, in my purse or my pocket. Never know when I'll need it.
All right, time to tally up your answers and reveal your heartburn type. So, Jen and Jess, I want to hear from you again which letter you answered most frequently. May not be all that letter, but the one you answered most frequently.
Dr. Oz, I'm
A C.
I'm A. What?
You really are different. All right, so,
We are twins, but we had so different. We different triggers, obviously.
so I'm going to start with Jess because she answered most of the A's. So that means you're the foodie heartburn type. Dr. Davis, this means things like spicy, fatty foods or caffeine can trigger heartburn. Why is that?
Yeah, so my patients love these foods, and so do I. And so the spicy, fatty foods and caffeine, they're harder to digest, they linger longer in your stomach, and they push up on that esophageal sphincter, that doorway that causes heartburn. So the good news is that we're not saying to stop these meals, we're just saying to decrease the meal consumption. Portions are important.
Yeah, I mean, good for you. Like spicy foods actually reduce your appetite, in part because they're slowing down how everything moves through. But some people have the problem. All right, if you answered mostly B's, which neither of the twins did, that means you're a sleepy heartburn type. Dr. Davis, what's going on with these folks?
So it all makes sense. Lack of sleep, poor quality of sleep. That's why it's important to make sure you get 7 to 8 hours of sleep per night. That slows down the digestive tract. If you're awake, what are you going to do? You're more likely to eat and consume meals. So lack of sleep, poor quality, eating late at night increases your chance of heartburn.
It always stunned me if people eat late because if you're trying to go to sleep, don't you want your intestines to go to sleep? Right? You got to go to sleep all at once. The whole body's got to go down. All right, if you answered most of these C's like Jen, that means you're the stress heartburn type. So how would you describe your stress right now, Jen?
It is through the roof. With the pandemic and planning things for myself and the family, I mean, without this trusty to-do list, I don't know where I would be, but it's crazy right now, Dr. Oz. Right. On 10.
It is for all of us. Dr. Davis, you argue this is the most common heartburn type.
Yes, and with the pandemic, as mentioned, the pandemic stress has increases the heartburn. So you want to make sure you sort of kind of relax and chill out, if you will. The stress also leads to loss of appetite. You slow down your digestion. All this is kind of like the perfect formula for heartburn. So try to sort of find your zen and relax.
Well stated. Thank you for taking the quiz with us, Jen and Jess. I hope it helped you settle what's really causing you heartburn. All right, up next, everybody, the personalized plan for your heartburn type. How to stop that burn no matter what type of heartburn you have. We're back with the quizzes to unlock your health power. Now, we revealed your heartburn type. You're either a foodie heartburn person or a sleepy heartburn person, or maybe you're a stress heartburn type. Dr. Samson Davis is back. Let's start with the first type, which is foodie heartburn. This is the type that's triggered by acid-promoting foods that may be spicy or fatty, all the things you love. But Dr. Davis says you don't have to give it up completely. Instead, here's a little half-C's hack. A half-C's hack.
Yes.
Is that medical jargon?
Well, a little bit, a little combination of layman and medical. But the spicy foods, which I love, by the way, they have an ingredient called capsaicin, which is good for decongestion, but capsaicin increases reflux. So you want to be mindful of that. And fatty foods, like look at this burger. Who doesn't like a burger? But with the half-C rule, what you do with the burger, you take your knife and you cut it in half. And by cutting it in half, you have half and you give someone else the other half, and therefore you decrease your chance of acid reflux.
All right, so put that on this plate. We're going to show you what the plate looks like. Now, if I had just this on a plate, I'd be a little unhappy. So Dr. Davis argues, right, you can fill up the rest of your plate with an alkaline super salad. How does that balance it out?
So with the alkaline super salad, which I like, the one ingredient that's often come with salad is cheese. And a lot of people may or may not know cheese increases your reflux. It's like similar to like a lemon. When you bite a lemon, you get that acid feeling what cheese can cause. But with the alkaline salad, what I love about it is that it balances it out and it creates a sort of a yin and a yang effect. So you have your radishes, you have your broccoli, your spinach, your cucumbers, your avocado. All that is very tasty and goes well with the burger.
I missed the avocado. There it is. Well, I like to use the bread, whatever the half-Z part is, to eat the salad. You sort of spoon it in, push it into your fork. It's a simple little dumb thing, but the salad dressing itself can get, absorbed by the bread. This is how I eat my meals as well.
Yeah.
All right, the sleepy heartburn type is next. This is a problem for a lot of folks. How will a meal curfew help beat this?
So a meal curfew is something that you have to be mindful of. So that's why we have the alarm clock. If you're planning on going to sleep at 10 p.m., you want to make sure you set the alarm clock for 7. You want to consume your last meal at least 3 hours before you go to sleep. So you set the alarm, and when it goes off, you eat your meal, and 3 hours later, you prepare for bed.
Yeah, teas work to get you through that time. A lot of us want to put something in our mouth late at night, but it's actually not food. It's just anything, frankly.
Right.
So find something that works for you. All right, I also recommend that you raise the head of the bed to help with that reflux. This is one of the oldest tips. My dad taught me this when I was a kid because I would hear him giving the advice to patients because it was so common even back in the 60s. So how can this help elevating the head?
So you think about gravity. When you lie flat, all that acid sort of pulls and come back into your esophagus. So by raising the head of the bed, you're allowing the acid to sort of go where it belongs, down the pipeway. So you want to take a book, a set of books you could put underneath the mattress between the box spring and the mattress, or you could put it underneath the legs of the bed on the right and the left side.
Now, you can do that, or you can buy one of these beds. Now, this is one that lets you elevate. There it is. You push one button, and you notice I got my name on there for a reason, because sleeping elevated could help you reduce your acid reflux, but it was also one of the reasons that I got so passionate about creating these adjustable bed bases. You know, these things are known by folks in the know, right, sleep experts. We just haven't gotten it because it used to be too expensive. But either put the books there or get one of these beds. There are so many problems like acid reflux, things like snoring that can be helped by the way we actually sleep. We're not supposed to sleep flat, at least all of us. Okay, next, the heartburn that's that type related to stress, which has grown to become the #1 reason we have heartburn, partly because of COVID-19. And I recently was reminded to take a 20-minute a day period for yourself. It helps you refocus and calm you down. And the person who taught me that was on the show, I guess on the show, and it was done so elegantly, I began starting to do it more often. But when I was taught transcendental meditation, I was also taught 20 minutes. That period of time seems to be the right amount for most of us. Yeah. Then I learned you do it. You got a little tick as an ER doc, and the ER docs are the busiest people in the hospital. So what's your tool?
So my day starts at 6 a.m. So you want to get your mind right so your body can follow. So 20 minutes a day, I start out my shift, 6 o'clock in the morning. I meditate for 20 minutes, 4 seconds in, hold it for a second, and then out for 4 seconds. And then just that breathing alone calms you. I also have my red notebook.
So you have music you love the most to get you there?
I have music that I listen to, but my meditation is the first thing. But I have music as well. Nothing too crazy, right. Just nice and tranquil, so I just kind of relax. So the music itself and the meditation I listen through my headphones as well. So that calms me and get my day started right, because now my mind is right and the way I'm looking at things are brighter and kind of a bit more succinct. And then I have my notebook. My red notebook here I've had for a few years. I write down positive thoughts, mantras, chats, things of that nature to sort of get me through the day. Now, in the moment in the ER when it's going crazy, because we do have moments when it's very busy, I do simple things like chew gum, and I have a stress ball as well that I use sometimes to get me through those few minutes of stress. You know,
you amaze me more every time I work with you. It's fantastic. Know that you work these tools out.
Yes.
They're one of those things you come in here dapper, you figured it all out. But if you know, to go through the things you have to go through in life, everyone, no matter where you are, has issues. Yeah. Figure them out with some tools like you just gave us.
Yes, work in progress.
We all are. All right, you can find the Heartburn quiz and the customized plan on DrOz.com. Please take advantage of it. We made it for you guys. It's free, and share it with your friends. Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.